So this idea that we ought to talk about COVID, I have to give you a little background. So I'm a brain doctor, a neurologist, but my career has been, I'm interested in developing therapeutics for brain disorders, and I got hooked by the excitement of battling HIV/AIDS back in the start of my career, and spent a good part of my life developing the therapeutics for HIV and AIDS. I ran the National Institute of Health study for brain disorders in that condition and coordinated the major medical schools' efforts. So I've been interested in viruses in the brain for a very long time and have continued that battle. So I always pay attention to new viruses that come along, and we've recently gone through this COVID epidemic, and it just struck me that we as a church, as a people, when major things impact our lives, it's important to handle them and deal with them, but it's also important to reflect on them and learn from them. And a few weeks ago, Pastor Katie had a sermon about how we learn and explore and feel our faith when we're afraid, when we're lost, when we are in trouble. And I think that pandemics are one of the few places and times in modern times when the whole world suddenly was lost and afraid. You know, I think most people are pretty comfortable. They've got a safe local environment, but every once in a while something hits our world that just transports most everybody to a place where they are not comfortable, where they're afraid, where they're feeling lost. And I think March of 2020 was one of those times when suddenly healthy people thought, you know, I could die. I see people getting things suddenly and dying, and I don't know how to be safe. I don't know how to get to safety. And so my notion is that COVID is such a big thing that we ought to stop, pay attention to it, and think carefully about what kind of lessons can we learn to be better people, better Christians, going through the rest of our lives, informed by that decision. And just to remind you how big the COVID thing has been, remember it broke in early 2020. Since then, yesterday there were 6,977,000 documented deaths. So a little worse than the Holocaust in terms of deaths in the last 3 years. 771 million documented cases, and you know how many non-documented cases, so wow, is it common. And over 4,000 new cases a day, so it hasn't gone away. It still is in our lives and something to think about. And the world has really responded in a remarkable way. There have been more than 13 billion doses of vaccine delivered already in just 3.5 years or so. So a remarkable event in human history and a remarkable human response. And the thing that I want to emphasize is that it's remarkable how it has affected us. And Dori and I have thought about themes. We've got 3 themes. Today we're going to talk a lot about community and isolation and what this epidemic has taught us about that. Next week we're talking about how this has shone a light on who's essential, what is the value of people. And the third week we're talking about how this pandemic has taught us about change and evolution, and that as a part of our life experience. But today we're going to talk about community, and the reason this virus brings community to such a sharp, interesting focus for us to consider is that this is a respiratory virus. So let me just back off and be a medical school teacher here for just a minute. Viruses are, just sort of something that is a way of a vector of disease. But viruses are actually little pieces of nucleic acid. They have the code for life, but they aren't life. And the way they carry on is that they have a way of recognizing the cell that will help it to grow and carry forward. So they have a recognition receptor. In HIV, the HIV virus recognizes the CD4, which is a marker on lymphocytes, and it says, aha, this is my home, this is my kitchen. If I go into this cell, I can make copies of myself and have a successful ongoing life. So HIV virus picks white blood cells and replicates there, and it trashes the immune system and gives us all sorts of interesting problems. But it's not so easy to pass it from one person to another because we don't put up our white cells to be grabbed onto by this virus so easily, right? The COVID virus is a kind of a cold virus, and it likes a thing called the angiotensin ACE. Chelate, anyway, ACE is the protein, angiotensin converting enzyme. It has a protein that the spike recognizes. It says, aha, this is the kind of home that I like. And it turns out ACE is on the cells in the respiratory system, in the nose and in the lungs. And so it's a respiratory virus. And the problem with this is that if we share the air that we breathe with others, we can breathe in a copy of this virus, and it is such a good grabber for those cells that just a smidge of it can hit those cells and start an infection in us. And as a brand new virus arriving from China, nobody had any immunity to it whatsoever. So this virus was delighted and could grow really fast and really successfully. And what happened is the virus grows. First 4 or 5 days, you have a stuffy nose, you feel sick and have a fever, and then your body kicks in and has an incredible immune response. And people die from the immune response because these ACE receptors cause vasodilation and secretions come out, and the lungs fill up and you drown from your immune response. And that's how people die of the COVID infection. Not the virus itself. The virus doesn't kill you. You drown in your immune response to the virus. But it's a dramatic, horrible thing. And obviously people with good immune systems are the ones that die. And so that's how it happens. So the problem here is that we have to suddenly quit breathing each other's air. And that turns out to be hard to do. And so the way you do that is you isolate as much as you can. You separate people so that the air you breathe is diluted out and you don't have to breathe something that anybody else has breathed in. It's shocking, and we all were struck by the fact that when we sit in a room like this, we share the air, guys, and it's not so bad when we're just sitting and being quiet, but if we are talking a lot, so I'm standing back from you and trying to be less infectious, but if we're face to face, we'll get this virus transmitted very, very easily. And it turns out, sadly, when you're singing, oh, then the virus just streams out over the crowd. And so these settings that we have in churches and other places are especially liable. Well, so we said, this is disastrous. our hospitals are going to fill up. We're going to have tens of millions of deaths. And what are we going to do? We have no tools to fight this virus. We don't know how to treat it. We have no antibiotics that will stop it. We've got to protect the world. And so we rationally did something that has never been done before. And we said, look, we have got to isolate people as much as we can possibly do in society. And so the COVID epidemic gave us an incredible, unbelievable experiment in social isolation. And I just want to, I think that for purposes of our discussion, we'll just cover a few of the areas where that hit, but the impact of that and the importance of it and what it teaches us about community and about individuals, I think is where I think there are things we can reflect on and learn. But how did we change our behavior? Well, one thing, most people were told, if you can work from home, you should work from home. So work. Dori, I was going to have PowerPoint. I always talk with PowerPoint. And so Dori says, I'm not very comfortable with PowerPoint. And I thought, well, you know, surely I could keep people's attention without a slide, right? But oh my God, it's hard. I was going to show you the graph of how quickly the virus spread, and the first mutation of the virus happened very early in the epidemic, and the spread of that mutation. Here's January of 2020, and here's March of 2020, and the curve went, yeah, like this. And the point of the slide was going to be, as the virus changed, the whole virus spread throughout the world in a matter of 3 months. So a change in the virus could spread from China to New York City, to London, to Cape Town, to Honolulu, zoom around the world in just 3 months. And so it emphasized, by this sharing of air that happens around the world, how closely linked the entire world is. You wouldn't think, I honestly didn't know where Wuhan, China was in January 2020. And yet, I'm breathing the air from somebody from Wuhan, or passed through from somebody from Wuhan in a matter of months. So to me, that's one of the lessons. The world is a tight-knit community, markedly tighter and more related than we appreciate in our day-to-day life. And to me, people always believe, they reinforce what they already believe, okay? You know, I have to confess, I'm a globalist. I believe in humanity across the world. I've spent 20 years going to Ethiopia and working in the medical school in Ethiopia. I care about people around the world, and I think we all ought to do that. But, you know, there's plenty to do in St. Louis, and so it's fine to focus everything you want to do at home. But I do believe that the way God sees the world, and truly the way we need to see the world, is that it is a global community that is very, very tightly linked and has very few meaningful borders. The borders of countries are totally meaningless to disease. Totally meaningless to disease but they're also meaningless to the values of humanity as well. Similarly, race, we'd like to believe sometimes that people of different races are different in some way. They're more susceptible, more likely to have this, less likely to have that. Doctors have reinforced this by often making the first line of our notes, this 49-year-old African American, blah, 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 as if that mattered. And we are more and more realizing that race has almost no intrinsic, the genetics of race have almost no intrinsic meaning for diseases or the spread of disease. And so I think that's also true. Anyway, to me, this is a remarkable example of the global world. And the question is, if we try to set up boundaries for isolation, which we really needed to do at this juncture in society, because without that, because everybody is so susceptible to this virus and we don't know what to do to take care of people, we've got to slow the virus down. And the only way we can slow it down is to quit breathing each other's air. So we changed work and we said, if you can stay home, stay home. And so that's stay home. And if you've got to work, then set up barriers, wear masks, try to keep from breathing and touching and doing anything. So barriers, if you can't get out of it. And incidentally, and we'll talk about this the next time, who gets to have the pick positions where they can stay home? Usually the best educated, the richest folks get to be safer, right? Okay, so that's what happens in work. What happens, our little kids? They're the vectors of disease. They just love carrying bugs all over. We all know that. And so we can't have those kids going to school. So we as a society, believe it or not, shut down our schools. Right? Okay, so no in-person schools. Okay. Doctor's right. But we tried to, of course, we set up education, online education, homeschooling, huge change in our whole society. And there are people right now, I'm one of them that thinks that the longest COVID impact that there is this year or so hiatus in the development of our kids in schools. And no value to this at all. Was that the right thing, the wrong thing to do? I favored shutting the schools down and doing this too. I think we all did because isolation was really critical and kids were a vector. But huge cost, a huge societal impact. I would bring up nursing homes and hospitals. Turns out vulnerable people, the elderly, frail people were really dying fast and in high numbers. And so protecting our elders in the nursing home became a huge priority. But they were getting sick and dying and were not being visited, and even the staff was not going in to see them as regularly and with the same attention. In the hospitals, we had the same tragedy. People that are disastrously sick are dying. Their spouses and families are being told, you may not come. We cannot have people coming in and out of our hospital and spreading the disease through our hospital where all these vulnerable people are. And so a huge societal, tragic choice had to be made. And in the nursing homes, there was a huge price to pay the isolation of people that already have some degenerative disease or not as closely connected with society fell off cliffs and really had a devastating, progressive, terrible course. So again, that was a big area. Let me see, I had some other area. Imagine that, church. I guess I would get around to talking about that here, wouldn't I? Yeah, so church. Wow. What are we going to do about church? We can't voluntarily come and share our germs, and especially not sing our songs that we like to do. Oh my God, that's impossible. So we had to make some tough choices about church and how to do that. And again, the value of our church community was undiminished, and we have been blessed in this pandemic because it engendered growth in our ways where we can relate and meet with each other and communicate. So we now have online, and somebody may watch this video and get to do it even though they didn't get to be in my germ field today. And similarly, our church services are going out in ways that we didn't get to do before. But that value of the community, of physically being together, of touching and hugging, speaking to it, that part of the human interaction we lost for a period of time. And there was a price to pay for that. And so I would just bring that up as the issues of community that we lost. So anyway, I think this whole experiment was an important one, and I hope that we will carry away from it both lessons about how valuable the community is, how being together is really critical. And in all of these areas, we're struggling. I know at work, people are talking about how workers don't want to go back into the office, and the downtowns are empty in a number of our great cities because nobody wants to go back to in-person work. And yet, the vitality, the growth, the inspiration of spontaneous interactions in groups, I believe, and I think many people do believe, there is a unique value in that community and that direct interaction that we're struggling not to lose, and trying to get what's good out of both sides of this experience. With our schools, I think many of us are looking back and saying we overdid it, that turns out kids don't get as sick from COVID even the first time around, and not too many died. We don't want any children to die, but was the impact of disrupting their social development and their learning curve for this period of time, was that too great a price? And in any case, the value and the effort that we put into that critical development in schools is really important. How we run our nursing homes and hospitals we've got a long way to go to improve that. And this experience of separating people from those they love when they're in crisis is a terrible experiment that I hope we never have to replace. And we'll talk about what you feel like the church is doing, but that's the reflection that I had about our experience, a remarkable experience of illustrating the value and importance of community, and even the minimal effort to disrupt and isolate ourselves, to preserve our society, to preserve the world to the greatest degree that we could, with the best of intentions, had a remarkably huge price. and that I think we need to reflect on and pray over. So that's my thought. Comments before I leave? I'm going to have to go up and prepare for the choir, but anybody want to challenge, comment? Tom, of course.
Well, there was a word that when somebody died, if they had COVID, they said they died of COVID, and so maybe they sort of exaggerated the death.
Yeah, you're right. You're right. Yeah, viruses rarely are the direct killers. It's usually our response to them that happens. That's true of influenza, a lot of the viruses. And even HIV. People can live just sopping full of HIV, and you can't even tell it. That's why they keep transmitting it and having relations where, and it's only when the end organs get into trouble that the viruses kill. We can live happily with most viruses. Dori?